Head of Urology at the Aga Khan University in Karachi. He has an extensive background in urology with notable achievements in both clinical and academic domains. He's a member of several editorial boards for international urological journals and has authored over 130 articles in peer-reviewed journals. Additionally, he has written over 10 book chapters and edited 3 international books. Professor Ather is also actively engaged as an advisor and reviewer for numerous international urological journals, as well as for dissertations and theses at various universities worldwide. Dr. Hammad has extensive training and leadership experience in prestigious European universities and holds key roles in urological associations. So now, Dr. Hammad, you have the floor and you have the podium and the screen.
Right. Thank you very much, Roa, for very generous, most of which I don't really deserve. So I've been asked to talk about meaningful research, and unfortunately, I'm going to touch upon some of the classical definitions and touch upon some of the debates surrounding the word meaningful itself. So we all know that research is essentially to establish and develop new conclusions, creation of new knowledge, the ability to understand new methodologies, and the whole exercise is about creativity. It's not about duplication. It's not about doing the same thing that has been done previously. So it's about a new search. So this is what research is about. Now, we add another dimension to this research by introducing the term meaningful research, and I'll touch upon that and what are the controversies which are there with this terminology. So for young researchers like yourself and those who are entering into the arena of research, the question really is that I have all set myself to become a physician or a doctor or a surgeon. What is this research thing has come up in between? Now, I'll tell you personally, I mean, I've always been a clinician and I'm still a clinician. And at the moment, I'm waiting for my case to be under, and hopefully at 6 o'clock, I'll be operating again. But I end up doing some research, mostly clinical work. But it really helped me to expand my knowledge base. It helped me to keep myself updated on information. All these points that you see on the screen, I've been able to narrow my area of expertise, because as you know that even if you want to become a neurosurgeon or a urologist or a neurologist, you can't really do justice to each and every aspect of this specialty. So you have to narrow it down so that you start working on a focus, and it's only on that focus that you'll be able to reach people, you will be able to do problem solving and encourage curiosity, not only in your audience, but also in your own quest for knowledge. This is an interesting statement, and I'm sure most of you probably have read this before, but I must read it again, that one must attend in medical practice, not primarily to plausible theories, but to experience combined with reason. And I'm sure that those who don't know who said that would think this is a very contemporary statement. This is what modern medicine is about, that we don't work on theories and anecdotal evidence, but we work upon reasoning and science. So medicine is a branch of science. However, this was said not recently, but by somebody called Hippocrates. And this is over 2,500 years back. So have we really progressed from that time till now, when very recently, only in the later part of the last century, 1990s, that the term evidence-based medicine was coined. And we know that evidence-based medicine is about clinical expertise, best research evidence, and patient values. And these all three together, what we create and what we call is evidence-based practice. And this is the clinical pyramid in which the quality of evidence is assessed by the quality of work which was done. So systematic review of a randomized controlled trial is at the pinnacle of, and the expert opinion, like my opinion about doing something, is at the bottom of the pyramid. So essentially, evidence-based medicine, as is defined by David Sackett at McMaster, is a conscientious, explicit, and judicious use of current best practice in making clinical decision about the patient's care. Now, Roa asked me to talk about meaningful research. So that's all good about research. I mean, this is research, fine. You create a question, you define your methodology, and then you do some research work, you find new answers or new explanations about things, you publish your work. But what is about this meaningful research? Now, if I look at the definition of meaningful, it gives you all those similes: significant, relevant, valid, worthwhile, purposeful, consequential, weighty, pithy. So all these are essentially what meaningful is. That if your research, your hard work is not significant and it is only used to publish a paper in a low quality journal, I think it is not worth the effort. It has to be relevant, it has to be important, it has to make an impact on what you do. Now, how would you assess that? Well, there are various metric-based research evaluations, which include citations. So if your work is cited by others, it has to be relevant, it has to be meaningful, it has to be high quality. If your I-10 index or H10 index, H index is high, meaning that what you have done was meaningful. The number of PhD students that are working with you, the amount of grant money that you have, and various other tools which are used by various institutions and countries, like the REF, which is the Research Excellence Framework. That's what we call in Britain. The VQR, which is an Italian version of the same thing, which essentially stands for Valutazione della Qualità della Ricerca, which essentially means evaluation of the quality of research that you do. Or the ERA, which is the Australian counterpart of it. Similarly, the universities essentially use the Time Higher Education Indices or the QS index that you know to evaluate your universities. All these are there, and these are the metric-based evaluations. It's pretty simple to do. You can go onto internet, find out what is the I-10 or H index of any scientist, and you would know in a matter of seconds how he or she has done in this metric-based evaluation. Now, I'm going to challenge you a little bit on this concept, and then we'll take you through some of my own conundrums in understanding the value of meaningful research. Now, all this may be high, but if it is not impacting your patient's care or patient's overall evaluation, then it is not meaningful as a clinical scientist. I mean, obviously, if you're a basic scientist, it has different definitions and meaning. Similarly, if your research has very little impact on society, then again, it is not likely to be meaningful. I don't know how many of you have seen Black Mirror on the Netflix. It's a dystopian science fiction series from Britain. I mean, it was there since last 10 years. It often describes scenarios in the near future employing technology that is already available or soon might be available. Now, this creates a dystopian world, and I'll take you through some of the next few slides to show that some of the matrices that we use are really very dystopian. So somebody said that study life as it is now in our times through the speculative lens of changing technology is what it's all about. This process of conducting and reposting research would be entirely gamified. So, as researchers, are we sitting on computers and playing some dystopian game, creating a world which is unlikely to benefit from all our hard work? So, we need to see whether we are overplaying these metric-based evaluation systems and they're not taking over the quality and meaningfulness of from our research. Now, there are certain hidden dangers in accepting these indicators. Although they are very convenient, just a few clicks of button and you will know exactly where you stand objectively. However, over-reliance on these indicators may end up making it more difficult to introduce a change for better. So I think these are some of the concepts that you probably need to understand before we find a definition of meaningful research. Somebody said that research excellence tells us nothing about how important the science is and everything about who decides. So we know about those institutions, we know about those departments which creates those models to define excellence in research. Okay, so this is a bit of a concept that you need to really struggle. However, in the broader definition of meaningful research, we need to understand that whatever we do has to be comprehensible, it should be relevant, and it should be valid, and it contributes to the intellectual framework of our sphere of work. So meaningful research has to be worthwhile. It may or may not score highly on your citation index, but if it is worthwhile, if it is making a difference, in my opinion, it is more relevant and meaningful than a highly cited article. Remember that we have evolved over decades, millennia in fact, from the time of Hippocrates 2,500 years back to now, and each and every, I think there's some audio, somebody's audio open. Anyhow, so the research often unfolds over time, which essentially means that you're making a little contribution in terms of a small block, and this small block will build up into a building. So it's not important that your bit and contribution in research essentially should be the final word, but it becomes a little element to develop into a whole story. In more simplified version of what am I talking about is that in order to do a meaningful research, the first step is to develop a research question. And I think young researchers, and in fact every researchers, find it most difficult to formulate a precise question that is answerable. Now, the second question that you will ask yourself is that the answer to the question, is it important to pursue? If the answer to your question is worth pursuing, then you should continue doing research. The next question that you ask yourself when you're starting a new project is, does the answer add to the present knowledge base? Well, if it adds to the new knowledge base, to the current knowledge base, again, it's worth pursuing. Does it simply confirm a previous observation? Sometimes it is important that you reconfirm the findings of another researcher. So it's not really novel, but it is a reconfirmation, and it is, again, important. You may be describing it better than what description has been provided previously. So how would you develop a good research question, you need to be novel. You need to preferably based upon new technologies, but these new technologies should have some past. It can lead to new directions, so it has a future, and it is important to current concerns, so it has a present. So whatever you do, it is in the context of the time that you are living in, but it is for the times to come. And as I've said, that it is often a very small building block for the whole story to unfold. How do you get an idea? And I think that's the most difficult thing to do, is to get a research idea. Sometimes you are lucky, you're standing under a tree and it falls on your head and you get an idea. Sometimes you have to refresh your ideas. And some of the institutions basically ask their researchers to take a bath, because sometimes you can get an idea while taking a bath. So the famous Archimedes principle. Well, you may look at a problem from different angles. I mean, so yes, it is a Mercedes, an old-fashioned Mercedes, but you can look at it from various different angles, and it may give you a totally new, fresh way of researching. Sometimes the most important thing is to be innovative, and this is my favorite video clip about innovation. So really, innovation is the key to your. Now, moving back to our research question, and I would describe this in 5 steps. Number 1 is to choose a subject that you're genuinely curious about, because it is a lot of hard work. So if there is something that is not of your interest, please do not enter into that area. I'm sorry about this phone call. Let me disconnect it. Okay, sorry. So it's important that you should research on areas which are your real interest. Carry out some preliminary research, focus on precise issues within the broader topic. Create an interesting research question. And this we have talked about a little bit. This question has to be original. I mean, you may get ideas from your research, literature search, but it has to be really something which has not been reported. So you have to look at it from a different angle. It should be focused. It should be complex enough so that someone else would not start working on it. And by the time you finish, it is already reported. It should be achievable. Obviously, you need to see where you're working, what your resource constraints are, what kind of funding is available. So would you be able to conduct that research and be able to complete the task? So that's important, that it should be achievable. Now, when you write your proposal, each and every word count. So it's important that when you send your proposal for research, you need to really write it precisely so that your funder or granting agency would approve of your proposal. And some of the simplified ways is the PICO or the PO model. And I'm sure that most of you know what PICO is. The population, patient, problem, intervention, comparison, and outcome. So this is a simple model on which you can base your research. So in an older man with a low back pain, is manual therapy more effective than drug therapy in relieving pain? Is a research question. So the P is the characteristic of the patient and the problem. Older men with a back problem, low back ache. What intervention? The intervention is that the manual therapy The comparison is with the conventional treatment, which is the drug therapy, and what outcomes are you looking at is pain relief. Okay, so the research question is fragmented through the PICO model into very simplified way of assessing your, and this will explain how would you define your methodology for research. If you do not have a comparison group, you can use a PO model in which there is no comparison between groups. So the research process, in essence, is a research question, literature search, study design, measurements, data analysis, interpretation, conclusion, and then the cycle starts again. So you move from one research question, and while you're doing research, you may come up with another question, and so on. So idea, develop, fund, plan, do the research, complete the process, publish, read, and then the whole cycle starts again and again. And this is how you become an academic surgeon or academic physician. Remember, do something which is worth a while, and that's what meaningful research is. I find that there's a lot of work being published and reported, and there are very few readers. So if all your effort goes into nobody reading it, nobody taking a note out of it, it's a waste of an exercise, right? And that's why the research has to be meaningful. If you look at this, there are thousands of articles contributed daily to biomedical journals. There are hundreds of paper published, research trials reported, etc. But most of them end up here, which is the bias and the confounding trash can. And this is where most of the research ends up. It's only very little which actually end up being meaningful and helpful to the community. So how would you know your research is meaningful? Well, you need to look at the research, who is funded. So if Coca-Cola has funded the research, obviously drinking Coke and its impact would not be taken nicely if it says that it is health, it provides you good health and hygiene. Similarly, where it is published. So if it is published in a reputable journal with a good independent peer review process, then again, that research is likely to be meaningful. Again, it's also important that what kind of work, I mean, it's a small cohort study, or it is a randomized controlled trial, or it is a meta-analysis or a systematic review of a randomized trial, which again is something that is at the highest pinnacle of our evidence-based medicine. I'm sorry. And how would you find flaws in that research? Myself, as a reviewer for over 20 journals, I find that by looking and critically analyzing those research papers, I've learned a lot in critically evaluating a paper, that whenever I read a paper in a biomedical journal, I'm able to look and find flaws in that research. And that's how I decide which research paper is important and meaningful for me to implement into my clinical practice. So in essence, purely metric-based indicator for evaluating research would lead, in my opinion, to a dystopian environment, and you would be really playing games in a close quarter, a video game, rather than actually contributing to the academic database. There are hidden dangers in accepting convenient matrices like the I-10 index and the citation and so on. When you over-rely on those indices, you actually give a lot of power to the institutions which control those indices rather than contribute something which is. So in essence, I don't want to confuse you further, but defining meaningful research is difficult. You need to look at in your own context, what is worthwhile, what is meaningful, what can contribute to the betterment of your patient care or defining a better methodology, a better diagnostic tool, etc., whenever you do research. Thank you very much for your attention, and I'll be happy to take questions. I hope I am done.
Thank you very much, Dr. Hammad, for distilling a highly complex topic and for providing us and our clinical scientists with not only an external narrative to it, but an internal narrative to it, where they have to think and ponder in order to create personal responsibility, which is obviously in line with originality and novelty. And I think it's very bold to take on the dystopian take that you took here. I think that's a very new thing that I've come across, to be very honest, in meaningful research, and I found it very, very exciting. We're open to questions, and Dr. Hammad, I'll be taking the first question now. Moez is asking, how is the research meaningful if it is confirming a previously published work?
So I have said that it is meaningful because what somebody has done may not essentially be the correct methodology. If I have done something and it is confirmed by another independent researcher who is not affiliated anyways to me, and confirming my findings, essentially saying that this is the right thing. So if a diagnostic tool is developed by Khan University, and there is another institution within the country or outside which uses the same tool and confirms that, right, this tool is correct and it provides better information than the existing one, then this is meaningful research because it is something which can now be incorporated into the clinical practice. But if you only, that's also true, but if you only keep doing and repeating the work of others, you probably may not be doing justice to your efforts and hard work.
That is true. Dr. Hammad, we have new questions from Zehra, and she has 3 questions in line for you. And I hope you can also read for your case.
Yeah, I can read it. So number 1 is that how you can become a reviewer. In fact, becoming a reviewer is really something as a first step in critical evaluation of papers. Well, sometimes you are approached by the journals because journals are looking for reviewers. You can also approach journal. You can write to the editor that you have an interest in research and this is your focus of interest, and you will be happy to review because this is a lot of voluntary work, and journals are really very happy to recruit new enthusiastic researchers. So in your opinion, retrospective study is enough to pursue the... Okay, so I always say to young people that start off research at a low level and then keep moving. Your first article would not be published in Science or Nature or New England Journal of Medicine, etc. Your papers will be published in smaller journals, and you will learn over a period of time how to move from an intern to a senior consultant. So you need to take those steps carefully, and with each step, you'll be able to. So doing retrospective studies or case reports or case series is not bad. Audit and something that would tell you about the methodology of doing research. So is the journal impact factor contributory for the quality? Yeah, this is what exactly I was touching upon, that the current matrix indices are objective, they are mathematical, and they are easy to do. But again, they are the most reliable way of assessing the quality of research. Although this is the tool that we have at the moment, but one should look at these tools in a rather critical fashion and do not use them as absolute indicators of the quality of research. Where will the dystopian art field lead us? Well, it will lead us to a blind alley. And if we continue to sit in small rooms, and we will become those computer nerds rather than actual researchers. So it's important that you look at the impact of the work that you have done. And you need to be, as a clinician, you need to be not only sitting in front of the computers and computing and analyzing and searching, but also what is the impact of your work on the day-to-day clinical work and practice as clinicians. If you are a basic scientist, what impact it has done in improving the methodologies of conducting research, and how you have defined a new methods which is cheaper or which is convenient or easier, etc. So it all depends upon your area of work and how can you actually make an impact. End of the day, what really matters is that you have strengthened science and you have contributed something new to the understanding of this world. Okay, Tessin asked about, are there any sources would like to share to gain further insight in the metric-based indicators? Well, I can share one article and we'll send it to Rua and she can distribute it to your, and this is basically not only talking about these matrices, but also challenging those matrices as well. So I'll share that article and I think Rua can send it to all the group members. What is the most appropriate tool for data collection? How to learn data analysis? Well, it's something that really depends upon the kind of work that you're doing. And we have various mathematical systems and model and statistical packages which are there, which can actually make your work really very easy. So, I mean, I know that you guys are much more better than what you used to be because you've been taught research methodologies at the OA levels, whereas we only come to learn these things much later in our life. So there are so many ways of data analysis and data collection tools that are available through various statistical packages that are there. Great. I think that's about it.
Thank you very much, Dr. Hammad. I just have a last question. It would hardly take a minute. There's over-reliance on scores or models or scales that have already been crafted by major big institutes. And now there's a trend of crafting and tailoring it to the resource-limited settings. And there's also a bias that the older the scale is, it's better because it was original, and then there are revisions to that particular scale. What's your idea based on that? Should we be crafting our own tools and scales and scores that are essentially tailored to our population?
I mean, I personally believe that the tools that are there are good. They have been tested in a wider context. We have various major limitations, both in terms of lab-based research and also in certain clinical areas as well. Although we have a huge clinical pool which can be tapped to develop those different tools of assessment. However, I believe that in order to develop those tools and to use them in the local, you can actually use the existing ones and modify a little bit based upon our specific needs. But they require a lot of hard work. And these tools are developed by these big institutions which have a lot of money, which they invest on manpower, and this manpower force develop those and refine those tools. Somehow we lack that kind of infrastructure in most institutions. So if we can do that, it would be really very useful. However, it's really a difficult and onerous task.
I agree. Dr. Hammad, is just Rabith who has raised her hand, so we'll just take that question and then we're good. Rabith, could you ask?
Yeah, hi. Yes, I'm so sorry. And thank you for catering my question. Just a short question. When we start off research in our med school, apart from AKU, a lot of med schools don't really teach quality research, or they don't really teach research in general, right? So we start off with basic researches which are maybe not that high quality, but as we go on, we kind of start getting concerned about more about the quality of our papers. So what is your opinion on maybe at any individual at our level, what can we do to increase the quality of our work?
Okay, so I mean, I wrote my first paper as a case report in Journal of Pakistan Medical Association. This was way back many decades. This is how I started, and this is how most of us start. You guys are starting at a much higher level than what way we have started, because you guys have been taught certain basic research methodologies in very early part of your career, even before you get into the medical schools. It is in the ONA levels that you know a lot about the types of studies, what is a cohort study, what is a cross-sectional study, and so on. So essentially, how can you improve upon it is by hard work. So unfortunately, there is no easier solution. There is no shortcut path to doing quality work. It's by only doing hard work and evaluating and critically analyzing in each and every aspect of what you have done, learning from your own mistakes and learning from the mistakes of others. So if you read paper and critically analyze that paper, like in a journal club, you probably would not do the same mistake next time you do a research study. So read a lot and look at it from a very critical point and try and find out issues with it. And that's how you will be able to learn and move further.
Thank you very much, Dr. Hammad, and thank you everyone as well. Dr. Hammad, thank you for a highly engaging and interactive session. I'm sure the dystopian and the wonderful contemporary examples helped us a lot. Thank you very much for having time, and all the very best for your procedure that's planned. Thank you.
Pleasure. Hello.